I hate all this waiting around time.
Me too.
Let's leave then.
Oh. Marley, we are going to find out how come we can't have a baby.
Well, we could do it another time. Say a year or two.
Marley.
I'm serious, Jake. We have plenty of time. We're still young.
What are you afraid of?
The doctors here will say the same thing as the doctor in California, Jake. I'm never going to be able to have a child.
There is no such thing as never anymore. If you have a problem, even if I have a problem, there is still a way for us to conceive.
What do you mean, if you have a problem?
I'm getting tested today.
What for, sweetheart?
Infertility, isn't that what we're here for?
Well, why should you go through something like that? You don't have anything wrong with you.
Listen to me. We are going to go through this together.
Okay. Thank you so much for setting up these appointments.
Yeah, we really appreciate it.
I'm glad I could help. Well, do we start the test right away?
Not right away. First, they have to do all that boring stuff about getting your history and your family's history and all of that.
Right, how long will that take?
I don't know, but if it doesn't take too long, they might start on the test today. There are so many tests these days and so many possible treatments if there's a problem.
Well, I hope none of them will be necessary.
I do, too. And that is, of course, another possibility. But isn't it a comfort to know if you do need it, it's there?
Yeah. You're right.
Okay. I'm going to walk you down to Dr. Wallstetter's office. But before we go, would you like to talk to me or discuss anything or ask anything?
I can't think of anything, can you?
Nothing off the top of my head.
Okay.
Well, fine. Then after you have the tests and after you've discussed the medical aspect with your doctor, if you want to, we could sit and discuss the problem, if there is a problem, and how it might emotionally affect your lives.
I hope that won't be necessary.
I do, too. Okay, you guys ready?
Ready? Okay.
Let's go.
Well, now, that wasn't so bad. What is the next step?
Well, I guess it all depends.
Mary, I'm serious. What happens if I cannot conceive?
Oh, honey, I'm sure the doctor will explain all of that in detail.
I know, but can't you give me the slightest hint?
Well, gosh, I only know what I've read. I know that there is artificial insemination. There are fertility drugs. There's in vitro fertilization. There are really incredible things going on these days.
All right, now what happens if all of those fail?
Can we have a slightly positive attitude here?
Please, Mary, what happens if all of those procedures fail?
Well, I guess the bottom line is there is always adoption. But why are we even talking about this now? Let's not get into making plans or decisions until we know what your options are.
Okay. Thank you so much for helping us through this time.
I really am glad to be able to do it.
I guess it's just been extremely difficult for us.
I understand that. But think how lucky you are to have, in Jake, a husband who is willing to put aside the very well-known McKinnon macho to help make it easier for you.
Well, your nephew is one wonderful man.
I think a lot of what's good in him comes from knowing you. And I really, really believe that with the love that you have for each other and a positive attitude, if you want children, there will be children in your future. Hi, I'm sorry I'm late again.
Hey, you're not late.
I am. I got stopped by Dr. Bassi.
Better get stopped for speeding.
Not necessarily. That man has a tendency to go on a bit.
Oh, hello, Mary.
Hi.
Hi, Vince.
Hi.
Did you get our test results back?
Dr. Bassi didn't call you?
No, he didn't. Did you talk to him? What did he say?
You know what? I better get that faucet that's leaking fixed.
No.
I'll be back.
So did he give you our test results?
Well, he showed them to me before I left the hospital, but I really shouldn't discuss them with you before you've talked to him.
It wasn't good, was it?
Now, don't go jumping to conclusions. It's just that I'm a psychologist. And the medical doctors can be very defensive about their territory.
I can't conceive children, can I?
Marley!
Now, the doctor in California told me it was because of scar tissue. Is that the problem?
Yeah, scar tissue can be a problem or it cannot be a problem. It all depends on where it is. But there could be a lot of other reasons why you and Jake haven't been able to conceive a child.
Well, what have I done wrong?
Would you stop blaming yourself? It takes two to make a baby, remember?
Yes, I know, but Jake, what? Mary, Jake doesn't have a problem, does he?
Marley, honey, call the doctor. And then I'll talk to you about it.
Please, what is wrong? Please tell me.
Yeah, what is it?
Oh, hi. She got her test results back from Dr. Bassi, so...
Let's have a look at it.
Yes.
Yeah, sorry, not until you've talked to him.
What do you mean? There are tests. We paid for them. Let's look at them. What's the problem, man?
Well, first, I don't have the results here. But even if I did, they're medical tests, and I'm not a doctor.
So what?
So it's not my place to explain them to patients.
Wait a minute. I'm not a patient. I'm your nephew.
Please, Mary.
Oh. Okay. Okay. Sometimes the answer that we get is not what we've been expecting.
Like what?
Like Jake.
Well, let me leave. I could
No,
leave if you...
no, please. That's not fair. We're trying to figure out why we can't have a baby. I mean,
Right.
what is it? Is it as bad
Right.
as we heard it was in California?
Dr. Bassi did say that the tests on Marley were not conclusive yet, but that another problem has shown up.
Oh, no.
That has to do with Jake.
What do you mean?
Your test showed a very low sperm count.
Now, that doesn't mean that we cannot have children, right?
Not necessarily, but it can make it very difficult.
But not impossible, so what do we do?
You talk to the doctor, and I'm sure he will have very specific recommendations.
All right, then we'll see him tomorrow, okay, sweetie?
He's wrong. There's nothing the matter with me.
Jake, if your tests show a low
I don't want to
sperm
hear anything else about tests. It's not true, all right?
Jake.
What private discussion was that?
Between you and Marley yesterday when I left.
Ah, that private discussion.
Yeah, what? What is so secret?
You want me to tell you what was discussed in a private discussion?
Is it unethical?
Not only unethical, it's none of your business.
Hey, Jake is my nephew.
What's your problem?
Hi, Jake.
Oh, you look awful.
Well, I'm glad you pointed that out, Vince. I never noticed.
Well, breakfast will help.
All I want some coffee, Mary.
Just coffee? You? Champion of breakfast?
Look, Vince, I'm really not in the mood for jokes, especially after the punch Mary delivered me last night.
What in the world did you tell him?
It's highly confidential,
The
then.
big news, Vince, is that I'm probably sterile.
No, I did not say that.
Well, you could have fooled me, Mary.
Jake, I didn't... Well, okay, guys. I'm going to work.
Mm-hmm. Okay, Jake. Let's talk about this. So it's just a low sperm count.
Just, what the hell do you mean, just?
Could be worse.
How?
Well, you could really be sterile. At least this way there is a chance.
Oh, a chance.
Well, isn't there?
I don't want a chance, Vince. I want to be a father.
Sure you do.
When you're the father of 4 kids, you don't know what this is like.
Well, this is about how you feel about yourself as a man.
Listen, I don't want a pep talk, all right?
You don't need a pep talk. What you need is an education.
It's already been explained to me.
But you still feel as though you're not a real man because of it, right?
I can handle it in my head, but emotionally, it's a little rocky.
Jake, You'll get a handle on it. You will.
Man, all this time, Marley and me thought it was, her problem.
She loves you, and you love her. And as long as that's...
Good morning.
There she is. How do people look that good in the morning? Would you like some French toast?
Just coffee, if you have any left. Thank you.
Always coffee on the McKinnon stove.
Thank you. Good morning, sweetheart. How did you sleep last night?
He is right. You are beautiful in the morning.
You didn't answer my question.
How was Vicky last night?
Vicky?
Cheryl called. Now, she
was much better. Actually, Jamie gave her some medicine to help her with the morning sickness.
You saw Vicky last night?
Well, just for a few minutes.
Oh, you didn't mention that?
Well, you didn't feel much like talking, remember?
What did she say?
About what?
About our situation. You must have talked to her about it.
You know, sweetheart, Victoria's been very concerned about whether or not I can have a child, and I wanted to tell her that the test results show that it may be possible.
I better take off. I'll see you two kids tonight, huh?
Okay.
Here's little Mikey.
Hey, you two, come on in. Hi, we just went by the Hudson farm looking for Mike.
Yeah, Clara's hands were a little full, poor thing.
Yeah, well, somebody should have told me about the change.
Oh, I didn't even think about...
There's no harm done. It's perfectly all right. It's just I'm supposed to notify the board about any changes.
Of course you are.
And some of them can be very rigid about this kind of thing.
Look, you don't have to explain. I understand.
Little Mikey looks quite at home here.
I tell you, he won't be lacking for attention.
No, I guess not. I wonder, could we take a quick look at his room?
Of course you can. Right upstairs.
Mikey, you want to show us your room?
Come on,
Well,
Mikey.
nobody look at our room. I left it a mess. I mean, just a couple of things.
All right.
What have you got there? Is that a spaceship?
Josie, can I talk to you for a sec?
Sure.
I was wondering if you might like to go to the campus concert with me.
Guy like you.
Yeah, sure is, but it's a sweet room, Shirley. It's just darling good. Well, you know what I have to do, my little sweetie? I gotta go back to the office and write a report for the board. That's what I have to do. I'm afraid so, yes, but I'm sure he's just fine. Goodbye, sweetheart. We'll see you soon.
You bet we will.
You know what I was thinking?
What?
He hasn't seen the barn yet, so, why don't we walk Mary and Vince to the car?
Oh,
Good
come on.
idea.
Hey,
We'll
let's go
just
see the
see.
barn.
Good
I'll
idea.
get those orders.
Bye, Charlie.
Take care. Yeah. Bye-bye.
Alrighty. Two more bite of this scrambled egg and we're out of here. Okay?
You're going about this all wrong, Matt. He's never gonna eat it this way.